as you know, if we look at the Canadian situation, things are moving towards much better control. Here in the province of Ontario, the numbers continue to go down, and some provinces are seeing very little transmission. But that's not to say that everything was perfect in the response to the first wave of this. I think that policymakers did adapt and show their ability to change as they went along, but there are things that we would have done differently if everybody had the ability of hindsight. You look at a whole range of issues around long-term care, as I pointed out before, and the fact that so much energy went into the acute care sector and making sure that hospitals were ready and emergency departments were ready. And we really got caught off guard in terms of looking at people living in institutional care. So those are things that obviously are deep and tragic lessons that were learned along the way, but they will hopefully set us up well so that if and when a second or third wave comes along, that those protective mechanisms will be in place.
That's an important point. Are we using learnings effectively? If we had to compare the current situation and the reaction to it to something like SARS, for example, how would you characterize that?
Well, we often talk about SARS, and of course, it was a deep blow to the world, and there were tragically a number of deaths here in Canada. But what we've seen now makes SARS look like a very small phenomenon, and we never learn quite enough. So, we did learn around issues like the health workforce, and I think we've done a better job this time at making sure that the health workforce was protected and everybody prioritized up front getting personal protective equipment to the health workforce. There were some lessons around communication that came out of SARS that I would say have only been learned to varying degrees. We've seen certain jurisdictions in Canada where we've had fantastic communication, but in other areas the messages are a bit more mixed, and so we never get every little detail right. But the point is, going forward, those lessons around making sure that universal masking is a public policy that I think has taken us a little while to learn, but now is fairly deeply embedded in Canadian society. So those are the kinds of things that will put us in a better situation as we go forward for the coming months.
We're speaking with Jane Philpott. You mentioned masks and you use that word messaging. I mean, do you think ultimately the messaging may have been a bit confusing for people? And if the messaging had been more effective, that perhaps things would be a little different today when it comes to masks and using masks effectively?
Well, there are many things that one would go back again. If we could all reverse our calendars back to January the 1st, that we could have gotten ahead of things. And, I having been a policymaker myself in government, I recognize that you're often trying to make decisions based on a limited amount of data. You're trying to manage the uncertainties that are before you. And in general, across Canada, I think people have adapted relatively well, but masking is probably one of those good examples. Border closures is another example. Many things where, the message was not entirely clear until the evidence of the continued spread and the very serious nature of this pandemic was obvious. And so, we've adapted. I think public health has strengthened at the federal, provincial, and regional level across the country, and those public health voices are getting louder and clearer, and that is definitely going to put us in a better space in the days ahead. And this book certainly looks at so many of those issues, trying to find ways that we inform our public policy. It was an enormous task in a period of just a few weeks to pull together an entire textbook over 600 pages, but we wanted to do that so the information would be there.
Well, and sometimes we have a moment and we're all focused on it, and then we move on with our lives. And this has certainly not been one of those situations. This is evolving, and we're going to have to keep digging into all those subjects that you're looking into. We've heard a lot about the waves. You even made a reference to it yourself. Do you have a sense on how long we're going to have to get used to living with COVID, how long your own expectations are that this is going to be a reality in our lives?
Well, many things about this pandemic have surprised us. The pace of change has been something that is unprecedented. The ability of science, technology, business, and public policy to adapt has really been extraordinary. So it's a little hard to predict going forward because you're looking at things like vaccine development. And, normally you're talking a matter of years or decades for vaccine development. Here, we're looking at scrunching things down and could we be talking in a matter of months before there will be more widespread human trials on vaccines? And so, of course, everyone's optimistic that will change the face of what we have to anticipate in the years ahead. But I think everybody should be preparing for the fact that it could easily be 12 to 24 months before we get in a situation where vaccines are developed and widely in use. And so we are going to have to be in a world where physical distancing and the whole range of protective measures are a part of our lives for the months to come.
All right, so lots to consider there. And Jane, obviously there is policy and there are politics as well. And you've had your own experience with that as a cabinet minister. We talked about that in the introduction to the segment. Of course, while that was tied to the SNC scandal, recently, in the response, obviously, to COVID-19, now we're talking about the controversy with members of the Liberal government, the Prime Minister, and the We Charity. What has been your your response to those developments these last few days?
Well, I've largely been focused on my work here in my brand new job at Queen's as the Dean of the Faculty of Health Sciences. So I'm kind of enjoying being distanced from the world of politics as much as possible. But, governments, obviously, we hold them to high expectations. And in every circumstance, our expectations of our public officials are that they care for us and they look out for the Canadian public and what's in our best interest. And that's what I and others certainly expect in this regard.
Do you feel like there has been a challenge at the government level when you're dealing with something like this? The economy is shut down. There are a lot of people who are basically asking for aid and assistance, and that can very quickly, especially when you have to do things on the fly and you're not having the traditional checks that you would have in rolling out different programs, that opens the door for sometimes complicated situations.
Well, it certainly can. And I think, again, if I can just bring it back to the book that we just put out today, I think people will find some really interesting material in there around accountability of government and what are our expectations of the various orders of government and who's responsible for what. In Canada, as you know, we've got a bit of a complicated federal system, and some parts of healthcare are the responsibility of the federal government and other parts are provincial. And then we've got all sorts of regional governments, Indigenous governments. And so these are definitely good governance is a big key to how we're going to get through this pandemic with the minimal amount of harm to society and to individuals. And I would certainly look to the book to get some good examples. There's actually a bit of controversy and different views on what good governance looks like. And I think it's been tackled quite well in there. And I hope it will be well enjoyed.
All right, that book is called Vulnerable, The Law, Policy, and Ethics of COVID-19. Jane, thanks very much for your time this morning. We do appreciate it.
Thanks for having me on.
That's Jane Philpott joining us.